Hello, everyone. I'm Christina Arangio here with Dr. Julie Morison, local psychologist and founder of HPA Live Well in Albany. And this is the latest episode of The Real Deal, where we break down real-life concerns with an authentic conversation. We're just doing our best to get through this life, this crazy, messy, beautiful thing we call life. I know you've been busy.
Yeah, good busy, though.
I know. But
cramming as much as we can. What is it, like 10 pounds of stuff in a 5-pound bag?
Right.
Yeah, that's what we're trying to do.
Traveling with the family a little bit, back just for a little bit, then off again.
Yeah.
But, I mean, when the kids are on break and, or at least one of them.
Right. Well, exactly. Right. And wedging the other one in there. Just kind of, with my daughter and going to college, we're just like packing as much in as we possibly can.
I get that.
I think it's more for us than it is for her. She's like, you want to go on vacation? Sure, I'll go.
All
we're like,
right.
want to go? It's great.
Right. We need to have these times together as a family.
Exactly.
I completely understand that.
Busy but good.
Yeah. Yeah. Well, and I feel like the month is flying.
Yes.
But we've dedicated this entire month to eating disorders.
Yes.
And I know we were just talking recently, and I was like, okay, what else have we not touched on, because it's such a bear of a topic. There's so much to it. And you made a really good point that while we really highlighted a few things that I jotted down here. So we put a focus on what eating disorders are, how they can develop, how weight loss drugs can lead to relapses or trigger issues. But we still need to talk more about treatment for eating disorders.
Right.
How you break the dangerous cycle, and first, when you need to get help, how you get help, and then there's the right questions to ask too. So there's plenty to cover.
Right. Well, what we said was we did a real good job of worrying everyone. Right. Now we have to make sure people know that.
Exactly. Oh my gosh, this is horrible.
Deal with this. Right. And whether or not it should be considered a problem or not, right? Like, there's sort of this idea of an eating disorder versus disordered eating. Right. When do you cross that line? When are you taking your kid to the doctor? Those kinds of things.
Well, even that, eating disorder, disordered eating.
Right. So we talked about
not really the same thing?
Well, it's more casual, right? So, essentially, eating disorders we talked about, right? Those specific diagnostic criteria that, anorexia, for example, that intense fear of gaining weight despite already being thin, right? Versus or bulimia, where somebody is having an excessive overeating experience, like binge eating, and then they compensate through some sort of purging. Someone who might have just sort of some disordered eating may have some negative body image and says, ugh, I ate too much at, such and such dinner. I'm going to not eat as much tomorrow.
Right.
And so that's a little disordered in the sense of the anxiety that's sort of prompting the behavior change, right? Or sort of the guilt and shame in and around what you're eating, body discomfort when it comes to, say, I'm going to a party and I'm not comfortable in my own skin, so I'm a little disordered in my thinking about weight, shape, and size. Yep. That isn't necessarily something that we would identify as an eating disorder.
Okay,
but it's somewhat disordered, right?
That's interesting to note. Okay, so there is a difference here,
right? Because if your way of looking at yourself is affecting the way that you're taking care of yourself, that's disordered.
Mm-hmm. So when do you know that you need help, or someone you love, you're a parent, and you're seeing some concerning signs?
Yep. So I think a lot of people will say, I didn't know this was a problem. Right? The patient themselves. Even a teenage kid may say, I knew something was off, but I didn't know it was that bad. One of the things I think we realize is when a lot of disordered eating will start from trying to make a behavior change, right? I'm just trying to get healthy. And then those goals start to shift. Now it's taking over all of my thinking. I keep moving the goalpost here in terms of I want to lose more weight. I want to weigh less. I want to do those things. Or you can always ask yourself the question, it is never normal to throw up. Right? It means you've got the stomach bug. It means something didn't sit well. You've got an allergy. If you're making yourself vomit or compensate in a behavioral way for what you've eaten, that's an eating disorder. That's disordered. And so, feeling like you ate too much, Tuesday, and feeling like, you're going to have a smaller breakfast Wednesday, that's not an eating disorder. That's
Right,
somewhat
okay.
disordered, but
Yeah.
it's not an eating disorder.
Right, you're aware, like, you're coming up to
Right.
big events. For example, we recently, had the Super Bowl, and of course you have all those tailgate parties, and we always do a segment on the morning show about tailgate on 10, and everybody was like, okay, well, we're eating a lot this morning, so later on, dinner's going to be really light.
Right.
I'm just going to have a salad.
Right.
So that's, again, we're not at a point where that's
Right.
a
And
problem. We're just trying to be more aware, like, ooh, too many calories.
Because you
today.
also want to be reasonable if you're being mindful about the way you eat. No one can, eat out every single day or just have carrots every day, right? Like none of those extremes are workable.
Right.
So I think a couple of things, like I said, is the more extreme, the more concerning, right? Yeah. And the other thing is that your providers, the people in your life, things like that, they're there to kind of check your work, to say to someone, do you think I've lost too much weight? Or saying, even for someone who feels like they've gained weight and maybe they had a change in medication or something, and to go to your doctor and say, this doesn't feel good to me. I don't feel comfortable in my body. If you feel like you want to make a change in your weight, going to your provider and saying, well, what are your thoughts on this? What is a guided way that I could make some of these changes? Now, all of us could sit there and say, well, that sounds great, but how do you get in even to see your medical provider that easily, right? You got to have your head falling off in order to be able to get an appointment.
It's getting harder and harder.
And I think that, and I have to say I have been and continue to be so blessed with the providers that myself and my family have, but not everybody has that.
I know,
right?
I agree. I feel personally fortunate, but it's not that way for everyone.
It's not. And so being vigilant and not having it be a fire drill is really, really important because this stuff can go from bad to worse real fast.
Yeah, we've talked
really
about that.
fast. And sometimes, for a kid to get, we've all seen this with our own kids.
Yeah.
Someone will listen to, my kid may listen to you about something more than she would listen to me. Is that because you know more than me, or is it just because I'm just the mom? Sometimes the message giver, being more objective, being someone who comes from a position of knowledge like your pediatrician, is a really good opportunity to say to a kid, hey, listen, let's talk about what the issue is. If you're noting a change in the way that your kids are eating, either more so or less than changes in exercise, when a kid says to you, I want to be healthy, but healthy seems really rule-based and no wiggle room, that's of concern, right?
They would actually express that? Have you heard that?
You see it. Yeah. And it's not just what a kid is saying, it's also what they're doing. So a lot of times kids will have to say something to their parents because it changes the culture in your family, right? I'm just going to do this. I'm just going to do that, right? I'm going to go to the gym. Well, most kids aren't independently wealthy. They got to ask for that membership, right? They got to get a ride. And so you're noticing, I'm bringing this kid to the gym. I'm doing these kinds of things. You should be asking, what are you doing in there? Mm-hmm. Remember, those are big decisions to let your kid go off and do those things. Going out to lunch, having a credit card to just go spend to have, lunch during school. We need to be more responsible about that. And we've talked about that even in our own family is, that's a first independence
that is
that
big
someone
one.
Gets.
Yep.
And so anyway, that's
money.
Right. So there's all those variables. But the biggest message is this goes from bad to worse fast. Go and get it checked out. Talking to your doctor, but come prepared. One of the things, I've seen this with a family recently where they really did a nice job of taking sort of historical evidence to the doctor to say, hey, listen, I've noticed this over the last several weeks or months.
And it was for them personally?
The parent noticed it about the kid. Hey, listen, They were having family dinner, now they're making their own dinner. They were doing this, now they're doing that. These are the changes I'm noticing. They're looking a little bit thinner than I thought they were before. I'm going to bring them to you and just, here's what I've noticed. Here's the information, right? Everybody's got portals, right? Sending that information off to the doctor ahead of time.
So obviously you're not doing this in front of your child. You're making, and how do you get a hold of them?
Right. So here's the thing. I am not a big proponent of the back conversation, not in front of your kid.
Because you're kind of hiding it and you want them to be a part of the conversation?
Because you want the kid to be part of the conversation. And also, there's nothing more upsetting to a kid than to feel like you're talking about them.
Yeah.
Plus these kids need to know that it's okay to talk about things that are uncomfortable. So as a parent, you can say, I'm noticing some of these changes, and I'd just like you to go check in with your doctor. Or while you're at the doctor's appointment, maybe you don't necessarily say it preemptively. You say, you've got a checkup. Kids don't really pay attention
Right.
to why and where, whatever.
But so then the parent goes in because now, you reach a certain age too, and the parent doesn't even have to be in there. And of course, they at some point ask you to step out. They ask them personal questions. They're at a certain age. So how do you handle that?
So I think as a parent, if you've got a concern about any kind of disordered eating, you go to that appointment first and foremost. If your kid is under 18, they shouldn't really be seeing your kid in the office without you present.
Yeah, okay, right. 18 is that cutoff.
So you can sit in the waiting room, but you should go in initially. And, certainly you're welcome to say, I realize you may want me to step out before I do. I just wanted to bring this to your attention. And you say, look, we want to be talking to our kids consistently. We don't want to shock them with anything necessarily, but sometimes confronting issues in front of a provider can be helpful. To say, listen, I've noticed, and you give the kid credit, you said you were trying to get healthy, and I'm just wondering if it's getting a little bit off track.
Okay, so here's another thing that I'm going to chime in with.
Yeah.
Do you say to them ahead of time, because like you said, you want to have the conversation somewhat in front of them and give them credit where you can. You started out, you're trying to be healthier. But I would think if you tell them ahead of time, like, listen, I may bring this up when we go to the doctor, that might, scare them away, or so do you not in this case tell them ahead of time that, like you said, we should be having open conversations with our children anyway, but right before you go to something like this and you're going to express those concerns, do you tell your child and preset them or not?
So I think everybody's kid is going to be different.
Okay.
It depends your comfort level and your openness. My only feeling about it is if you're going to talk to them for the first time in front of the doctor, then after that doctor's appointment, you're going to need to own that. You're going to need to say, listen, I understand that could have been super uncomfortable for you today. And I felt like I needed to bring it up for the first time in front of the doctor so that we could have a really productive conversation.
Good advice.
Because you want to own it. Like as a parent, the other thing is, and I think I saw it probably on Instagram, was you remind your kids they're doing their lives for the first time, but you're doing parenting for the first time with them, right? So we're all just trying to figure it out. And you can get as much guidance as you want or have this be the thing you do. It's hard to be objective of your own kid, and you can own that. Look, I was born. You were born, and I started to worry. So here's what we're doing, and so this is the objective.
Even before
person.
You were born, when you were
right. I was worried about you being born. Yeah. So I think that those are the things, and just being honest around that. So I think that the other thing is that when kids are confronted on this stuff, they're real defensive early on, usually.
Yeah.
Because a lot of times when something gets brought to a doctor's attention, sometimes they feel like they're getting in trouble. I've done something wrong.
And they get embarrassed.
And they're embarrassed. And so to be able to say, look, this is just a hypothesis I have that it feels like something's going on, something feels off, and I want help talking to you about that.
Okay. Look, we're going to take a break, and then we're going to talk more about treatment options. But I have a few more questions with regard to this when we come back. So keep it here, and we'll have more from The Real Deal in just a moment.
Great.
Welcome back to The Real Deal with Julie in the midst of our conversations about eating disorders, and today talking about when to get help, how to get that help, and just that conversation with a doctor. Let's say you're the mother of a teen and you have some real concerns, and we were just saying, it really does vary. Sometimes you may discuss it ahead of time. Sometimes the first time you're discussing it is when you're in there with the doctor, but you said own it afterwards so that they understand, listen, I feel this was something important that I needed to bring up. And that's the thing about parenting, right? It really, this is exactly how you do it. 1, 2, if it was that easy, we'd all be set. But it's so different for every parent, every child.
Yeah.
You made an interesting point, and I'm trying to recall exactly what it was about when you're trying to get that help, that a follow-up may be necessary, right? Especially if your child seems to kind of explain it all the way when you're in there in front of the doctor, right?
Yeah. So kids are going to come out defensive because, again, when you bring something to the doctor, usually it's, I feel like I did something wrong, right? There's that defensive posture. Plus, also remember, if there is actually disordered eating there, they don't want to get rid of that necessarily.
They're going to protect it at all costs.
If you think about, let's take anorexia, for example, there's a fear of weight gain. So if I have a fear of weight gain and now you're telling my doctor that I might have this problem, that means that now everybody's going to be looking at my weight. I'm pretty mad. So I'm going to be defensive. I'm going to explain it away. A lot of the big ones, right? My stomach hurts. I just don't like that. I feel better when I don't eat such and such thing. I've just been busy. I'm stressed with school, things like that.
Exams,
exactly.
no time,
and
sports.
all of those things on paper are fair.
Valid.
They're
you would
real.
think, oh, right, sure, this
Right.
is explainable.
Right. But I think what you say is, okay, well, so stress has to, either way, we have to learn how to manage this, right? Because if stress is affecting your physical health, then we need to learn to manage that as well. One of the things I think that can be really helpful, especially because most physicians are not trained in this, right? It doesn't mean that they're not giving you their best and they're fantastic providers. Yeah. But unless they had a patient during residency or they had some sort of rotation, they don't really get eating disorder treatment training. So one of the things you want to do as an aware parent is to say the doctor says to you, okay, because you caught it early and they're like, listen, the weight is down a little bit and, they seem to be a little bit off, but let's just watch it. And I say to the kid, I want you to be eating breakfast, lunch, dinner, and snacks. And the kid says, okay.
All right,
and I say, you can't lose any more weight. Okay, no problem.
That's what the doctor would say.
Let's say the doctor says that. Okay, no problem. Oftentimes the doctor is going to say, call me if you have a problem.
Yeah, that's
My
it.
recommendation is when we present this to a kid and we want to know whether or not there's a problem, giving them a 4-week, 6-week follow-up with their primary care is fantastic because it's a weight on the same scale. It's the doctor checking in on the same thing. And you're telling this kid that in 6 weeks, I'm going to see whether or not this is a problem, right? And I'm going to see, because if there's no problem, this weight loss should have stopped. If this isn't a problem, you should be eating regularly, right? These things are going to figure themselves out. Maybe you start talking more to your parent about, your stress or whatever it happens to be. Yeah. But if those things aren't starting to iron out, then we do have some disordered eating. Right. And it's a great opportunity to catch it early, because that's when we are the most effective. Okay. And also sending the message is not the parent that's catching it now. Now it's the doctor. Now it became a medical thing that this kid is sort of a call to action versus a mom's gut feeling of like, this just feels off to me.
Right. Okay.
Which is helpful.
All right. So in that, you're waiting for the follow-up.
Yep.
How do you keep the teen from spiraling? And oh my goodness, now I'm on notice. I can't stop this. Like, that's a scary period for a parent and for the person going through it.
Sure.
What's the advice there?
Well, the silver lining of that distress is that, again, it's even more of a call to action. So you've got a 4 to 6 week follow-up. If this kid is even more restrictive or, avoiding you or in a worse mood, any of those things, you now know that I don't have to wait for 4 to 6 weeks for this doctor. We can start digging into this now.
This is something we have to address now.
And that's the recommendation is if you see a spiral, you go get an evaluation.
Okay.
From a provider practice that specializes in disordered eating that can at least just evaluate, where are we?
Where do you find that?
What is this? Well, it's easy for me to find it because it's in my, office. But my best recommendation, a couple of things. One of the biggest bank breakers is treatment for anything, right? And so my first recommendation to people is call your insurance. Call your insurance. On the back of your card, it'll say patient information, patient relations, customer service, whatever. Yep. Pick behavioral health. And you call them and you just say, I need to find an in-network provider that treats eating disorders. Okay. They then go through this whole listserv or whatever. Plus, you can do it usually online. You put in that information, and they give you a list of people who might be able to do this, and you call.
Okay, you call. Is this something where the child has to go with you again? Or, and I'm saying child, teen, whatever. Yeah. They go with you, right, because they have to have the evaluation. And I guess I just keep thinking of that angry person who hasn't accepted yet, even though the mom or adult going knows something's up now. How do you get the cooperation you need?
So the cooperation is really hard, and you got to hope that provider knows how to have that conversation with a resistant kid, right? So disordered eating is really, especially for someone who's kind of feeling like they're forced into this. I didn't want this. You called me out. Now I have to do this.
That's what I'm thinking.
That's a really defensive thing, right? Yeah. So you call the provider. And again, you're the mom. You're not the provider. So you're saying, look, this is a hypothesis, but ever since this has been happening, I've seen a downward. I'm going to ask that you do this evaluation.
Right.
And you say to the kid, just an evaluation.
Right.
It's not
you
a
have
guarantee.
To be firm and say,
I might be wrong, right? But
Right.
we're going to look into
We're
this
gonna do
because you deserve health care. And that's my job as your mom.
Mm-hmm.
And so you get an evaluation, hopefully not crazy far out. And if it is far out for somebody, you keep calling, but you're looking for a specialist. So specialists usually can turn this stuff out relatively reasonably for mental health concerns that are urgent, like an eating disorder. And you call and you get an eval, and it's okay to send information early. It's okay to say, we get this all the time. A parent will
send it to a
They'll
psychologist's office?
send an information to us via email, via a portal, and say, hey, listen, I'm really worried about my kid, and she or he really disagrees that this is a problem, but this is what I've noticed, this is what I'm worried about.
Yeah.
So that provider can start thinking about ways in which to discuss these concerns with the kid, but also recognizing that they're probably not going to be upfront about it. And so that's can be really helpful. And then, when the really important thing is that, so a couple things. One, the faster we catch disordered eating, the better off we are. But we also, as providers, what you want to do is make sure we're matching the level of care someone gets with the level of concern they have. Because you remember, with disordered eating, because they can be so incredibly serious and can cause medical concerns and other concerns, that, treatment is really on this spectrum of, you can go all the way from just individual therapy a couple of times a month and work with a dietitian, say, all the way up to an inpatient stay. And so what you really want to make sure is that this provider is able to assess the right level of care for your kid. Because again, we don't want to dance around this. We don't want to wait around. We don't want to wait for the shoe to drop. We want to treat early and we want to treat effectively.
Yeah. I guess, of course, what I'm thinking is in your mind, you're like, well, I know a great place because, but for someone who may not know and may not have that good recommendation, like you said, you call the insurance company, you get a list, but you don't know if they're going to be the right.
So speaking of that, right, so you can call your insurance company, you get your list, and then you can call your pediatrician again. And you can say, hey, listen, this is a list of 5 people. Can you help me narrow this down?
That's a great idea. That's what I was looking for. Because you always want to know, okay, I've heard good things before you blindly go in somewhere, and yet you're taking important steps. But call back your pediatrician.
Or you can also ask at that first visit, hey, listen, if this did turn out to be a concern, is there somewhere I should be calling for resources? Could I have that resource list just in case? Hopefully we won't need it. Could I get that now? Because a lot of doctors' offices have those referrals at the ready, have developed those contacts over the years. And what do I do if? Because a parent feels better when they don't have a fire drill.
Exactly. So a lot of this. All right. So the treatment really does. It's a wide range here. It could just be therapy, like you said. It could be inpatient, and that's why it's so important to have a good referral. Bottom line here, you really have to kind of go with your gut as a parent if you're right. I as you're talking, I'm thinking about this too, and I feel like how have I not known anyone personally except one person in my life? I was in college, and a friend reached out to me and told me, I actually had an eating disorder, and I remember being floored, like, what, really? Yeah. I think so much to the point where, and again, I don't think I'm speaking out of turn, where she was unable to have children. Yeah. Is that possible?
Oh, yeah.
Okay.
Yeah.
So I believe she told me this. I remember being ill-prepared to handle this, and I'm so sorry to hear this. I had no idea you were going through this.
Right.
But that is the only time, and I know it's clearly all around.
Yep.
You see it every day.
And it's more so than you think.
I guess.
And just because someone hasn't told you, it doesn't mean that they haven't struggled.
Right. So I've learned from you.
And they're on a spectrum. Again, also, they may be sort of in that, outpatient world of, less intensive symptoms where they're just struggling, right? And really negative body image and struggle, eating in public or whatever it happens to be. Yeah. And they don't really share that because they just aren't comfortable or whatever.
Or embarrassed or they want to hide it.
Right. Yeah. And remember, disordered eating is a disease of disconnection. So to keep the eating disorder, I have to keep it to myself, or you're going to say to me, what are you talking about? You're great. Well, you should be. You're fine. And so in order to keep this and to my secretive ways of managing my weight, I have to keep that to myself because I know it's disordered.
Yeah. I guess in trying to end on a positive here, like as you're a parent, you go with your gut, take those steps if you feel they're necessary. But the other piece of this is there clearly is help, and there is life after, and there are plenty of people who have moved forward. Am I correct in saying so?
You are correct in saying that. Yeah. And again, the messaging being the earlier we get this, the better off we are. Right. Yeah. And that, there's different pieces of disordered eating. There's the cognitive piece and the behavioral change. The behavioral change, we can be really strong at, right, with exposure therapy and different interventions. That cognitive piece, that worry, that body image, that discomfort in your own skin, that can be difficult because remember, this stuff is not just about food and weight, shape, and size. Disordered eating takes on a function. It's maybe a protective thing against bullying, or it's making you feel like you have some power in the world where you feel like you don't. We have to deal with those pieces. So remember, that's why we want to do this, because when you build the idea that I can only have those protections if I have my eating disorder, it's real hard for me to convince you to not have that then. Right. So that's why the earlier the better. Getting that stuff checked out, knowing where you're at, knowing where your kids are at, knowing what they're watching on, following on social media. Even if it's, these kids that are athletes that are like, I'm just going to eat chicken and rice, kids that'll say that all the time. That's the healthy thing. Where did you see that? Let me see the post. Let me understand who's sending this message to you.
Right. Because they get so much through social media.
So much.
Do you think there is more that we need to explore, or is there anything that we haven't touched on that you either want to address in closing or explore for another topic week or not? And it's okay if you don't have the answer right now.
I think that what we've done in the beginning, the first conversation we had was really about diagnostics, right? What are eating disorders? What do they look like? And then some of these sort of body image and then the social sort of new changes from the GLP-1s, stuff like that.
Yeah.
The goal today was to talk about that treatment is possible and it is positive. It could be really hard, and treatment, I'm not going to lie to you, eating disorder treatment takes a very long time.
It's not easy.
And I want to be clear about that.
Years?
Yeah.
Years.
Sure. And intensive care, right? Like, our treatment program, for example, is intensive. It's 4 hours, 4 days a week. You're talking about telling a kid, you got to give me 16 hours of your life every week to treat this.
Right.
It shows how hard it is to move the needle.
Okay.
Right? So we want to recognize that. But I think really the biggest message is we are sending messages to our kids and our community, our friends, our family, all the time when we reference our own body image, judgments of other people, comments about, somebody that you see. Those are the things that we societally can manage. I think the other thing is that, again, this isn't just about weight, shape, and size. The other messaging is many, many, many of our kids, at least, who develop disordered eating get it as a side effect from bullying and difficulties in school. Encourage your kids to be less judgmental. And you as adults, send the same message. Don't keep rumors going. Be the person that's willing to knock those things down or not judge based on appearance, and be a role model, because if we don't do that, we keep this going. And if you're talking about really getting things at the root, that'd be a big one.
Setting a positive example as much as we can.
And meaning it.
Yeah.
It's
one thing to say it, but.
Exactly. Walk what you're asking your kids to walk. Do what you're asking them to do. If you want your kid to talk open and honestly with their doctor, talk openly and honestly with your kid.
That's right.
And their doctor. Be an example of what you're asking them to do.
I think we end it there because it's such a great point.
Perfect.
Thanks, Julie. Appreciate it as always.
Yeah.
That's all the time we have for The Real Deal, but we'll see you back here next time.